A big challenge is billing and reimbursement issues. If you don't have the LOINC codes in place accurately, that leads to denied claims, delayed payments, audit issues, compliance issues. That's one of the biggest factors in it. And also patient safety risk. If you have a wrong test interpretation, if the wrong LOINC code is used, say we coded a urine glucose versus a blood glucose test, that could lead to misdiagnosis or inappropriate treatment. There's lots of examples we could use there. Another big one is providers will likely be repeating tests unnecessarily. And so they could miss important results. Patients are paying unnecessarily for repeated tests, and you're just wasting time and resources and putting patients at risk. Those are the big two in my mind. Can also think about failed data exchange. If they're inaccurate or inconsistent, breaks interoperability. Well, these are all things to consider with missing LOINC codes. Wyndi, do you have similar issues in your experience?
Yeah, with the implementation of a new LIS system, we needed to get everything LOINC mapped as well as dealing with several reference labs. And as you mentioned before, data exchange with other organizations, which we do with many other organizations, having LOINC mappings, not just for our lab, but our imaging. Also, we use this service to map SNOMED concepts, which we haven't talked about, to our organism mappings for the same LIS implementation for infection control. So we have found that by doing that, using the service or the tool, it cut down our analysts' time and trying to, again, dissect tens of thousands of LOINC codes into a matter of weeks of a shared partnership with IMO on the results of the initial mapping to get to the end goal.